All right, Vanessa, we're at 11:05. We are live, so go ahead and take it away.
Thank you. All right. Good morning, everyone. And thank you so much for joining us today for our Lunch and Learn on sleep education. My name is Vanessa Rorai, and I'm one of the program coordinators for the Healthier Black Elder Center. I'd like to start with a brief introduction of the Healthier Black Elder Center before we get started with our presentations. So the Healthier Black Elder Center started in 1997, and it's funded by the National Institute of Health. Our center aims to address and reduce health disparities through research and education. We do this through our research registry, where individuals learn about various social behavioral research studies and may be invited to participate in those studies. Currently, we have around 1,200 active older Black adults in the registry. We also host various events like today that provides health-related education to the community with a focus on aging. We provide education on topics that range from diabetes and heart health to food safety, nutrition, creating healthy habits, and brain health, and many more. Typically, we hold these events in person, and we hope you're still able to enjoy the virtual format in the meantime. To learn more about our program, please visit our website, and I'll also put this information in the chat. Our website is muckwar.org, which is M as in Mary, CUAAAR.org, or you can always call our office at 313-664-2616. For anyone that's joining us that's not currently an HBE member and you'd like to join, please call our office. We can complete your survey over the phone, get you added into our mailing list, and then you'll start to receive our biannual newsletter that includes all of our program events, recruiting studies, and more health information. So just in case, I'll give our office phone number again. It is 313-664-2616. And if you have any questions about today's program or just general questions about the HBE program, you can always give us a call at that number. So before we begin with the presentations, I'd like to make a few housekeeping announcements. Please remain muted during the event so we can hear the presentation as best as possible. This webinar is being recorded and it will be available to watch at a later time on our website. For those that are joining by computer, if you have a question for any of the speakers, please submit your questions in the Zoom chat or in the Q&A box, which should be located in a button at the bottom of your Zoom window at any time. For those that are joining by telephone, if you have a question that does not get answered by the end of our program, please give us a call at the office, leave us a message, and one of our staff will follow up with you. To start today's program, we will have a short presentation on a newer segment for our Lunch and Learn series called Critical Crossroads. Today's Critical Crossroads will be presented by one of our HBE members, Ms. Kathleen Newell, on her journey of applying for FEMA funding after experiencing flood damage to her home. And Ms. Kathleen, if you would like to turn your video on. I just sent you a prompt. Let me know if you see that.
I did. I'll try it again. Okay. For some reason or other, it's still showing that my video hasn't started. Okay.
Do you see the button at the bottom of your screen? It should say start video.
Yes, and I'm clicking on it and nothing is happening. I don't know why. I don't know what's going on.
And you know what? It's okay. I have your slides up. Go ahead and start presenting. I think we'll be okay.
All right. I'm hoping I can see the slides, but I've got copies. All right, here we go. Good morning. My name is Kathleen Newell. I'm going to give you a little bit about my background. I'm a practicing attorney. I have been practicing for 30 plus years. Prior to being in private practice, I had a focus in taxes and corporate law. My experience basically originated with administrative bodies at the federal and the state level. Internal Revenue Service, I was an estate and gift tax attorney. And for the state of Michigan, I was a hearing officer that conducted and presided over hearings related to the taxes administered by the Department of Revenue for the state of Michigan. I have been in private practice since 2005 from the state of Michigan, and I have focused my efforts in the areas of elder law and advocacy, probate law, and some experience in Medicare and Medicaid. I sit on the Institute of the Board of Gerontology Visitors, and I made contact with this organization through the Gerontology Board of Visitors and the director, Peter Lichtenberg. As a matter of fact, I was instrumental through the State Bar of Michigan getting Mr. Lichtenberg to speak to about 20,000 attorneys at the time that I presided over the Master Lawyer section of the State Bar of Michigan. I am a member of the Healthier Black Elders Center, became a member by joining the resource pool, and I have participated in a number of research projects. The most recent one I participated in was the, I think it was called the Healthy Study, where an individual, if they participated in the study, got a health coach that kind of helped them with medical issues for about 6 to 8 weeks. And it was a one-on-one program. I was really glad that I got involved in that because I'm very interested in health issues. I have been a very, well, it hasn't been that long, but I've been a member of a recent committee, Critical Crossroads, that was organized by the CAB board. And it was for the purpose of addressing inequities that they focused on, mainly racial inequities. And that is one of the reasons why we are presenting this particular presentation today. Okay, next slide. All right, I'm sure that many of you are aware of the tremendous changes that we are experiencing globally with our weather and our environment, not only here in Michigan, but globally in other countries as well. And Michigan, over, I'd say, the past 60 to 90 days, has experienced some terrific storms, and also many communities have been impacted by these storms. As a matter of fact, the one that we experienced most recently is probably the third or fourth very severe storm. On each of these occasions where we've had these storms in this local area, I have had flooding, but it has not been as serious as the most recent one that I had recently, where I experienced about, I'd say 3 to 4 inches of water in my basement. Okay, that was the only area where I had the problem. But you can imagine how, if you run down to your basement and you see water everywhere, it's quite a surprise and a shock. I was reluctant initially to contact FEMA, but I said, I'm gonna give it a try. So my experience began with making a phone call to FEMA, because at that time I had learned that this area, Michigan, had been declared a disaster area because of the degree of flooding that had occurred regionally. When I spoke to the FEMA representative, they basically opened a claim and told me that an inspector would be sent out within 7 to 10 days. They asked me about my flood damage. Basically, I gave them a description of what happened. They asked me whether I had any losses related to the flood damage, and I told them no, because I had really boxed up in crates anything that might be damaged in terms of papers and personal property. At that time, I was asked about insurance, and I told them I had property liability insurance, but no flood insurance. Next slide, please. I was contacted by an inspector by phone, and the inspector told me that they, as a matter of fact, I was contacted on the day that the inspector came out, and they came to my house, but they did not come inside. They didn't enter the home because they were told they were not to enter the home. So they relied essentially on my description of the damage I felt was caused by the water. My damage essentially was damage to the flooring, the entire basement flooring, the baseboards, and the surrounding area, particularly the tile in the basement. So I described that to them. Next slide, please. All right, one of the things that I thought was very important was knowing about the resources that are available for damage or losses caused by flooding. And most recently, HBC's, I think it's the fall newsletter, gives a pretty long description of all of the resources that are available. There are also resources both at the federal, state, county, and city level. So it's a good idea to kind of be prepared and have as much knowledge as you can about any possible loss you might have. It seemed as if when I talked to the inspector, they were more concerned about whether my residence was habitable as a result of any damage that I felt I had incurred. As a matter of fact, the application that's completed for your claim by FEMA talks about habitability of your place of residence, whether you're a homeowner or renter. And that has a lot to do with the decision from FEMA as to whether you will get the assistance through them. If they feel that, well, the application basically asks you, is your home safe to live in? There's a place on the application for that. And if your home is safe to live in, if it's habitable, you could be denied assistance by FEMA, like I was, because I told them, I said, sure, I can live in the home. And I didn't have any personal property losses. Your other option, if they deny you grant assistance, is to apply for an FDA loan. And they emphasize that you have to do both processes at the same time. You've got to apply for the FEMA, and you also have to apply for an SBA loan. I think in the slides it says FDA, but it's actually SBA loan. I did not complete the application for the SBA loan because I was waiting on the decision from FEMA as to my claim for assistance on the damage that I felt that I had experienced in my particular situation. After speaking with the inspector, that experience was quite unique because, as I said, the person didn't enter my home. They took a description of my water damage to the home, standing on the front of my porch. There was some issue with my claim related to ownership, and I want to point that out because sometimes we're unaware of the documents that will establish, say, ownership of the home other than a deed. And I did not have that information right in front of me at the time, but they would accept other forms of documentation like a mortgage statement, a utility bill. I'm trying to think what else, mortgage statement, utility bill, any other document. Oh, a driver's license, of course, which would show your address on the license. But apparently I had a little glitch with the ownership issue because records from the city did not reflect information that was in the Register of Deeds. And I don't know whether they checked both records, which they're public records and they would have been able to access them. But I am under the impression that they did not check the county records, that they only checked the city of Detroit records. So that's why it's very important for you to keep records like that, especially when you're filing a claim for any kind of assistance. And I'm sure you're aware that even with automobiles, any sort of loss or damage, you've got to be able to prove that you own or have title to the particular property. Let's see. As I said again, I did not complete the process related to the SBA loan. I did recently, which was very interesting, receive a decision, as a matter of fact, about a week ago from FEMA. It was a denial. It was basically their decision. They have an appeal process, and of course, there are deadlines. And I took a look at what's required for the appeal process, and I had already made up my mind I wasn't going to apply for the SBA loan, but I would have had to provide them documentation relating to ownership, which I had some of it, but I did not actually have the deed. And I had an issue because my spouse's name appeared in in Detroit records, and in Wayne County public records, both of our names appeared. So the records from public records didn't reconcile, and I didn't know what the reason was, but that's why it's always good to know where your records are kept, have them all stored in a safe place and together. One thing the inspector did indicate when I presented a copy, I believe, of my insurance statement showing that the property was insured, they asked me whether I had flood insurance, and I told them, no, I don't. If you get assistance from FEMA, you are required to purchase flood insurance afterwards. That's just a given. I think there's some information attached to the presentation that relates to flood insurance. I do know that it could be very expensive, and it depends upon a lot of different variables as to how much it costs. But I think one of the staff members is going to go over some of that information once I conclude my presentation. I'm going to read to you, I've got my letter of denial right here from FEMA. and it specifically indicates the reason for my denial in a sentence. I guess I'm trying to grab it here. Give me a minute. Well, I thought I had it in front of me, but to just, oh, here it is. It's dated August the 13th, 2021. It's related to my application number. It says, we have reviewed your application for disaster assistance. FEMA assistance is not a substitute for insurance and cannot cover all losses caused by a disaster. It's only intended to help with emergency disaster recovery needs. This letter explains why you're not receiving assistance at this time and the additional steps you can take to receive assistance. Your assistance is not approved because your home is safe to occupy. So that's basically the reason for the denial of FEMA assistance in my case. Now, it says you can appeal this decision. You have to provide a signed written explanation and a copy of documents that would indicate the damage to your home caused by the disaster, making your home unsafe to live in. So I think the whole gist of the application for FEMA assistance bears on whether property owner or even a tenant, in case you're renting premises, is unable to live in the property as a result of the damage. And hopefully it's not clear until you get into the process as to what FEMA will be looking at to grant you assistance. So to me, that indicates that it's always a good idea. Just file your claim and see what happens. All right, I think that is the end of my presentation.
Great. Thank you so much, Ms. Newell. I really appreciate you taking the time to share your experience of receiving flood damage and then the whole process of applying to FEMA. The last couple slides I'm going to quickly go over. One of our Critical Crossroads subcommittee members, Mr. Jim Bridgeforth, this is his son, Ron, who is an insurance agent, and he was really kind enough to share this common myths and facts on flood insurance. So there's a common myth that homeowners policy will cover damage caused by flood. The truth is, flood is not covered under standard homeowners insurance policies. Another common myth is, I don't need flood insurance, my neighborhood never floods. In truth, about 20% of all floods occur in low to moderate risk neighborhoods and neighborhoods that probably never flooded before. Just 1 inch of water that enters your home can cost thousands of dollars in damage. Another myth is, I can purchase flood insurance when I need it. In truth, it takes about 30 days for a flood insurance policy to take effect. And because you cannot predict floods 30 days in advance, it's important to carry flood insurance year round. And the last myth he shared with us is the government will pay for any federal flooding disasters. And in truth, as we heard today as well, the government will not pay for losses that is not covered by a flood policy. Floods and flash floods happen in all 50 states. And since 1978, the National Flood Insurance Program has paid over $36 billion for flood insurance claims and related costs. So the last slide, Sean, if you don't mind forwarding on, is a relist of our flood resources. So there are other options and things that people can go to for types of assistance and support. This exact list is included in our fall newsletter issue. If you're not currently a member with us, you can view our newsletter online, or you can give us a call. We're happy to mail you another copy. But we have a 211 number, City of Detroit, the Michigan Department of Housing and Human Services, and a Red Cross. So a few really important key phone numbers that may be of assistance. So if anyone has any comments or questions about our Critical Crossroad presentation today, please put it in the chat or the Q&A box. We will keep an eye on that. Thank you again to Kathleen for giving that really wonderful presentation and sharing her experience with us. We'll now transition over to our main presentation. Our speakers today are Dr. Robin Tucker from the Department of Food Science and Human Nutrition at Michigan State University and Program Instructor Nicole Wethington from Michigan State University Extension. Dr. Tucker and Nicole will be sharing the sleep education program, which was developed by Dr. Tucker, that covers many benefits of sleep on our health and tips to help you sleep longer, deeper, wake up more refreshed. So we would like to give Dr. Robin Tucker and Ms. Nicole Wethington a warm welcome and a big thanks for sharing this really important health information with us today.
Thank you so much, everyone, for allowing us to chat with you today about sleep. I think it's really exciting that you as a group have sleep on your radar, I guess, because it is so important. That's one of the topics we're going to cover today. And I think if you don't take anything else away from today's presentation, know that if you think you are a bad sleeper, that does not have to continue. We have ways to help you become a good sleeper. So that's what we're going to talk about today. So Nicole is going to start off the presentation. I will jump in at various points, and then we should have time for questions at the end. So we'd be excited to talk to you about anything that we missed and didn't cover. So go ahead, Nicole.
Thank you. Starting off, MSU is an affirmative action equal opportunity employer. Michigan State University Extension programs and materials are open to all without regard to race, color, national origin, sex, gender identity, religion, age, height, weight, disability, political beliefs, sexual orientation, marital status, family status, or veteran status. Our programs are open to all, and sleep is no different. At the end, we will have an opportunity for you to enroll in a longer sleep program. So hopefully you love the information that we're going to tell you today and you want more. So today we're going to be looking at the importance of sleep, both physically and mentally. We want to make sure we all understand how important that is for us. And we're going to recognize the importance of sleep hygiene. And we're going to look at different strategies to improve our sleep and how we can participate in this wonderful sleep program. So I want you to consider, how much sleep did you get last night? I want you to think if you had maybe less than 6 hours, or maybe more than 6, but not quite 7, maybe 7 to 9 hours, maybe more than 9. If you'd like to share in the chat, you're more than welcome to, but you can also just consider this. Keep this number in mind because we're going to revisit what your sleep could be later on. So I'm going to hand it back to Dr. Tucker for the importance of sleep and looking at how this impacts us physically and mentally.
Okay, so let's start off with a definition of what sleep is. I mean, it's something we all do, but maybe just having this understanding of what it is might be helpful. So many researchers and scientists, will describe sleep as a period of reduced responsiveness to the outside world, usually associated with immobility, and it's a reversible condition. So let's kind of break this down just a little bit. I think we all know that we can sleep through things, if something happens or you may just ignore people around you as you sleep. So that's the reduced responsiveness part of the definition. Usually associated with immobility. I say usually because there are certain sleep disorders where you are up and moving around, and that's not desirable, especially if you are not aware of what you are doing. You can get into some trouble. And it's reversible, meaning that that's what differentiates sleep from, say, a coma. We can enter and exit sleep pretty much at will, although there are just some times where you just try to fight sleep and you can't. It's just going to happen. And I'll share why that is the case in just a second. Regardless of how we define it, sleep appears to be essential in basically all animals that have been studied, but we don't know exactly why we have to sleep. What we do know is that there are many processes in the body that occur during sleep, or they occur at a faster or higher rate during sleep. We'll talk about some of those in just a second. Go ahead to the next slide, Nicole. So how do we sleep? There are two main systems in the body that are working together to help you fall asleep. The first system is something we call homeostatic sleep drive, which sounds more complicated than it needs to be. It also goes by a more, I think, accessible name called sleep debt. And when you wake up in the morning, your sleep debt is typically quite low because you've just topped off your sleep. But as you go through the day, the longer you're awake, the more sleep debt you get. And you can see that in that purple line here. We start off on the left-hand side, and sleep debt is increasing up until a certain point. The other system that we have is circadian rhythm. Now, oftentimes we just talk about circadian rhythm like it's just one big thing, but there are many processes in the body that follow a circadian rhythm. Circadian means about a day. So our circadian rhythm of interest when we talk about sleep is the circadian rhythm of alertness. You know, you've all experienced that at certain times of the day, you are more or less alert, right? What we see is that when we tend to fall asleep, we have the greatest amount of sleep debt and the lowest amount of alertness. And those are the two systems that are working together to help us fall asleep. Now, those don't always work in conjunction. Sometimes they tend to separate, and that's when we can have some sleep problems. But for the most part, they should be working together to promote sleep. If you use melatonin, for example, this is an over-the-counter supplement that you can purchase that works on circadian rhythm. It tells your body that alertness should decrease, and so it prompts you to fall asleep. So I get a lot of questions about melatonin. We can talk about that later if you're interested, but just so you're aware, melatonin is not working on sleep debt, it's working on circadian rhythm of alertness. Next slide. You've probably heard about different sleep stages. I'll just briefly kind of introduce that concept. The problem is they were recently renamed. So now they go by names like N1, N2, and N3, which is not super intuitive, but you might have heard of light sleep or slow wave or even deep sleep. Those are sort of the older names and names that are still commonly used. But we spend about half of our night in light sleep, either kind of transitioning into sleep or just sort of hanging out in light sleep. And that's where you're very easily awakened. And, if maybe you left the TV on and, that you hear that, you've been asleep, but you hear that wakes you up, you were in light sleep if that's something that's happening. The other half of the night is spent in more restorative stages of sleep if all is going well. So about half of the rest of the time, you would be in slow wave or deep sleep. This is considered restorative sleep. It does get affected by things like stress. If you're waking up frequently, you can get cheated out of some slow wave sleep. And as we get older, our ability to maximize slow wave sleep does start to decrease, but by no means are sleep problems a hallmark of aging. So just know that just because you may be in the older adult category, it doesn't mean that you have to have sleep problems. REM sleep is another component of also considered restorative sleep. This is when we tend to dream the most. So you're dreaming, you're probably in REM sleep. But REM sleep seems to be really important for things like memory formation. It's important for emotional control, your ability to sort of stay even keel. There are some studies that look at REM sleep and likelihood of developing post-traumatic stress disorder or PTSD. REM sleep appears to be really important to try to prevent that from occurring. We tend to do more REM sleep later on in the night. So if you're waking up, if you tend to kind of cheat yourself in terms of sleep, more time will be spent in slow wave sleep and less time spent in REM. To go through all of these sleep cycles, it takes about 90 minutes. So if you're sleeping less than 90 minutes, you probably won't go through all of those sleep cycles. But we'll talk about, I think we talk about, or maybe that's in the class, what the optimal time for a nap is. And it is not 90 minutes. I'll tell you that right now. Go ahead and go to the next slide, Nicole. This slide just shows you that sleep needs or sleep requirements change over the lifespan. So the younger you are, the more sleep you need. Sleep is really important for growth and development. But as we get older into the adult and into the older adult, which is considered above 65, you can see that sleep recommendations tend to sort of even out at about 7 to 9 hours per night. So that's your goal. We can talk about whether or not some of you think you need that much. You may be genetically gifted and be able to get by with less sleep than that. But what we do know is that your ability to sense how tired you are is compromised by insufficient sleep. So it's sort of this vicious cycle that can occur. Go ahead, Nicole. Okay, I just have a couple more slides before Nicole gets into more of the program itself, but I do want you to know that it's really important to prioritize sleep and make sure you're getting good quality sleep, because sleep problems are associated with all 10 leading causes of death in the United States. If you have questions about why that might be the case, I'd be happy to go into that later on, but just know that the big ticket items like heart disease, stroke, cancer, these are all associated with people who are sleeping typically less than 7 hours a night, or are reporting that they're not getting good quality sleep. So major effects on disease risk and disease management. If you have diabetes and are not sleeping well, your ability to control your blood sugar will be compromised. We can talk about that. Whatever you're interested, we'll talk about. Next slide. I do a lot of research on how insufficient sleep and poor quality sleep can contribute to obesity and weight gain. And there are multiple mechanisms by which that can happen. So multiple pathways, multiple changes that occur in the body under conditions of poor quality or insufficient sleep. Our research has found that when you don't get enough sleep, you feel hungrier because you have changes in the production of certain hormones tied to appetite. So if you feel hungrier, you may be eating more. That can contribute to weight gain. The little brain picture on the bottom right corner, it says increased susceptibility to hedonic aspects of food. That's a lot of sciencey terms. Let's break that down just a minute. What this means is that your brain reacts differently to tasty, high calorie food when you are sleep deprived. Your brain, let's take an example of, say, chocolate cake. I really like chocolate cake. Maybe you do too. When I am well rested, I can see chocolate cake and know that it will taste good. I can have some and probably stop with a reasonable serving. But if I am sleep deprived, I am going to look at that chocolate cake and have a much harder time eating a reasonable portion size, because my brain is just going to be, the chemicals secreted are just going to be making me really, really enjoy that chocolate cake, meaning I'm probably going to eat more of it. The last thing that we've noted in our lab is that if you're not sleeping enough, you're probably spending more time in very sedentary behavior, meaning you're not moving very much, you're not very active, and so you're not burning as many calories as you might if you're well rested. So you can see that all of those things together, these things don't just happen in isolation. They can be occurring, all at the same time, but they're all going to be promoting weight gain. And this is not an exhaustive list by any means. It's just some of the things that we have looked at in our research. But the thing I want to point out is that even if you're having sleep problems for just 1 or 2 nights, you can see these changes. So it's not like you have to have a chronic sleep problem to see this. You can start to experience these changes very, very quickly. That's not to stress you out and to think, oh, I didn't sleep very well last night, I'm going to gain a bunch of weight. No, but we want to make sure that you're getting more nights of good quality sleep than bad. Nicole. All right, so I'm gonna pipe down here and let Nicole take over.
So, are we actually getting enough sleep? The answer to that for a lot of us is going to be no. But the wonderful thing is there are pieces we can control and there are things that we can do. So sleep hygiene is one of my favorite concepts that we do go more in depth with in the full-length sleep program. So what is sleep hygiene? This is all the things that we can do to be able to sleep more and be able to fall asleep easier. So this is making adjustments to our habits, our environment, and potentially to our schedule. So why this matters is because our behaviors impact our sleep. Think about your habits. What do you do during the day that might impact your sleep? What's your bedtime routine? How do you feel after you're sleeping? So thinking about that, we have some strategies that we can use to improve sleep. Now, one of my favorite parts of the program are the goal setting aspects, because we take these wonderful pieces of knowledge and we can actually put them into our behaviors. So these are a few that we touch on during the program. The first is consistent bed and wake times. Setting regular bed and wake times can help keep sleep consistent, and it helps to prevent oversleeping on some days, which can lead to some undersleeping on other days, and we have this whole back and forth. So this strategy was reported as the #1 tip by sleep participants to improve their sleep. So if you do one of these tips, please make it this one. That consistent bed and wake time makes such a huge difference. Dr. Tucker mentioned naps. So we do talk more about naps in the full program, but naps can impact our sleep a lot. So if that's a struggle for you, maybe limiting your naps during the day, or if you're able to not nap as well. And caffeine consumption. So we want to avoid caffeine at least 6 hours before bedtime. And in the class, a lot of folks will talk about, what about tea? What about warm milk? All those kinds of things. And there isn't a lot of evidence to suggest that those work, but if that can be part of your comforting bedtime routine and you're not getting up to use the bathroom a bunch of times a night, then that can work for you. So really considering what works for your needs and making sure that it doesn't have caffeine. Food is another big one. So we want to avoid going to bed hungry because that can keep us up at night. But we also want to avoid eating or drinking a lot an hour before bedtime. So this may include adjusting your schedule a little bit. If you know you're going to be home late that day, making sure that you've got meal times planned so you're not hungry, but you're not eating too close to bedtime. Avoiding nicotine and or alcohol 2 hours before bedtime is also helpful. That's going to impact sleep quite a bit. Now, this one is sometimes a challenge for us, going to bed only when we're actually tired. Trying to force ourselves to sleep does not always work. So remember sleep drive. We want to make sure that we're working with all of these mechanisms. And a lot of people find that consistent routines help with this. So making sure that you are going to bed when you're tired, but not necessarily before that. And along the same lines, getting out of bed when we're unable to sleep. So if you don't fall asleep within about 10 minutes, try getting up and doing something else that's outside of the bedroom environment, and making sure that it's under dim light and it's not too stimulating, and then repeating that as necessary. So that works with both going to bed, but also when you wake up during the night. When we lie there ruminating or thinking about our lack of sleep, it's not usually doing us any good. So again, remember to keep any activity that you do when you get out of bed as boring as possible. So the bedroom is a big factor here. We want to reserve the bed and the bedroom for only sleep. That means avoiding watching TV in bed, avoiding reading in bed. I'm a reader. I know that one's hard for some of us, but having a comfortable chair, maybe out in the living room or somewhere else, and then going to bed when we're tired can be much better for our sleep habits. So avoiding all those activities in the bedroom helps to train our brain to associate the bed and the bedroom with sleep. We want to work with this, not against it. Another piece is assessing your sleep environment. We want to make sure that we're comfortable and that that environment supports sleep. Are your mattress and bedding comfortable? Is your pillow supportive? Is it a pleasant place to be? That can be a great place to start, making sure that your bedroom is a place that you want to sleep. Temperature plays an important role too. Is the room a comfortable temperature for sleeping? I personally like it very chilly when I'm going to bed, and there are reasons for this. One of the body's signals to sleep is a drop in core body temperature. So a warm bath or a warm shower about an hour before bed can help with that drop in temperature. And while your core body temperature falls before sleep, the temperature in your hands and feet increases. So I'm a fuzzy sock fan. That helps me go to sleep, definitely. But a warm foot bath or wearing socks can help to trigger that response, and that can lead to falling asleep more quickly. So we also want to avoid falling asleep with the TV on or with music on. As you go through those lighter sleep stages that Dr. Tucker mentioned, you might be awakened by those noises. You can use some earplugs or even white noise machines to minimize some of those disruptions. There are lots of apps, there are lots of devices for that, but you can also put on a radio just to static at a low volume, and that can have a very similar effect. So light in the bedroom is a big deal too. Thinking about light in general at night, even room level, the level of a lamp can disrupt your circadian rhythm. And Dr. Tucker had mentioned melatonin. This suppresses some of that production. So that's really important. We want to, again, work with what our body's doing. So try maybe using a red night light instead of a white light or another color. The red light has been found to be less disruptive to that process. Now, electronics can be a big challenge. And in the program, a lot of people mention electronics as a barrier to good sleep. When we think about electronics, they have light, they're stimulating, they can really have an effect on our sleep. So try putting these electronic devices away before bedtime. If we can get a couple of hours before, that's great, but as much as you can get. So avoiding blue light is another really important strategy. So when we think about electronics, a lot of these devices do have blue light, and we know that has a negative effect on our sleep. You know, after an early conversation with Dr. Tucker about sleep and all the pieces she was finding, I looked at my bedroom in the dark, and I was amazed at how many chargers and devices had blue light. I actually took a roll of electrical tape and covered all the things I could cover, and it made a huge difference in my sleep. So remember, check for red light, for night lights, for clocks, for anything that you are going to have, so that way you're minimizing that impact. So besides electronics, our mental activity does play a role here. If you're reading a really exciting book right before bed, or if you're working late, or you're really doing something strenuous mentally, this can impact your sleep and can make it harder to go to sleep. So trying to have some of those less stimulating activities, making sure that you are doing those outside of the bedroom in a dimly lit environment. For some of us, the mental activity is hard to turn off. So mindfulness is one wonderful way that we can calm our mind. We touch on this a lot in the program. So mindfulness is really paying attention to the present moment. It's bringing it back to exactly that moment we're in, and trying to let go of all the other pieces. So I like to do a brief practice so you actually can experience this. So I will invite everyone to find a comfortable position if you're able to, and we're going to do a very brief body scan. Allowing yourself to settle in to wherever you happen to be. I will invite you to bring all of your attention to your body. If you have thoughts pop in, you can acknowledge them and let them go, reminding yourself that you're paying attention just for a moment. I want you to bring your attention to your toes. Notice your toes, your feet. How do they feel if they're on the floor, in your shoes? Noticing any pressure that you feel, any sensations. Moving that awareness up your legs to your knees. Notice how your muscles feel, the joint. If you're sitting, noticing maybe the pressure on the chair. Bring the attention up your legs again to your hips. Noticing how they feel. Anything that might be tight, or maybe a lack of sensation. Bringing your attention up your body again to your shoulders. Noticing anything your body's telling you. Are you holding tension here? Maybe allowing that to release. Traveling up again to your head. Are you holding your jaw with tension? Do you notice the temperature? Is it cool? Is it warm? If you did notice any tension in your body, allowing that to release. And when you're ready, you can let go of that attention. So that is a very, very brief practice. And again, it's allowing ourselves to stay in that moment. That can help to calm a lot of the rumination, the thinking thoughts over and over again. And that has been shown to help us be able to fall asleep as well. So our next strategy is so important, physical activity. So we want to make sure we're getting daily physical activity, but considering the timing here, not exercising to the point of sweating within 1 hour of going to bed, because we don't want to disrupt sleep with this activity, but we do want to make sure we're getting it in. So I want you to think about what of those tips could you incorporate into your routine? Because it's wonderful to hear all this great information, but if we're not actually using it, it's not going to help our sleep. So along those lines, I want to talk to you about the Sleep Education for Everyone program. This is a wonderful education opportunity that we can hopefully use to improve sleep. So some background about this. In 2019, the Health Endowment Fund awarded a grant to Michigan State University to develop an evidence-based sleep program. And this was targeted to older adults. And that's how this program really came about. So we thank Dr. Tucker for all her work on this because it's been so wonderful for us to be able to bring to communities across the state. The funding source was designed to improve the health of older adults, but sleep can also stand for sleep education for everyone, not just for elders. And this really does apply to everyone, even younger adults. I have a young adult myself at home, and I've used these tips for him, and it's been so helpful. So really thinking about what we can do to improve sleep. So this program is 6 weeks long, and it's a wonderful brief shot in time. It's 30 minutes, but we get a lot done in that 30 minutes. We go through some sleep information. We have a variety of different topics I'll touch on in a minute. And in every session, we go through personal goal setting. We also brainstorm any solutions that we might need to obstacles. And we have a great group atmosphere. We do a lot of sharing. So we learn from each other, and it's really wonderful to have that group all come together and to see the progress that everybody makes over that 6 weeks. So as we think about this, this type of behavioral intervention has been shown to be as effective as medication in some studies. So we know that this does work. And we do have some early results from this program that we'll share in a little bit. So the topics that we cover in sleep are an introduction to sleep and health, and then those recommended duration guidelines. So we've touched on some of those today, along with the sleep hygiene best practices. And I really love that lesson because it helps to give people so many options of things to try. If you go down that list and implement all of those strategies, think of how much you can change your sleep. The third session, we talk about stimulus control therapy to get to sleep faster. And this is another great lesson because it's practical pieces that we can implement right away. The fourth lesson touches on mindfulness and relaxation to improve sleep. This is a favorite lesson for a lot of participants as well. The fifth lesson are relationships between sleep and physical activity. And then the last lesson, we bust a lot of sleep myths and we do a review and wrap up. And again, at all of these sessions, we're taking these goals and we report back on them. So that way we're accountable to the group and really drawing on that energy. So thinking about those goal pieces, we know that action plans lead to self-efficacy. That's our ability to know that we can change our own behavior. So in each session, we do have those goals and problem solving. And I always ask people to write them down to keep them handy because we want to actually do them. This helps turn that information, that knowledge into behavior change. And then our end result is getting some better sleep. So does sleep work? The answer to this is yes. And it's such wonderful results. Dr. Tucker, do you want to talk about this part?
Sure. So we've been working on developing sleep for probably the last 3 years or so. And we were able to do a small little pilot study to see if it was actually going to help people. And we published our work in a journal called The Nature and Science of Sleep. And I'm going to show you on the next slide the results. So for people who participated in our program compared to people who did not, the people from sleep improved their sleep quality as well as sleep duration, meaning they were sleeping longer. They also improved elements of sleep hygiene. So like Nicole mentioned, sleep hygiene, if you think about dental hygiene as like the things we do to protect our oral health, sleep hygiene are the things that we do to ensure good, sufficient sleep. And so we saw people were doing, engaging in those activities that are not helpful to sleep. They were doing those less, meaning that they had changed their behaviors. People also reported reduced daytime sleepiness. So this is a positive outcome in terms of quality of life. And the really exciting thing is, I mean, we had people fill out our survey immediately after the program, and yes, great. But what we also saw is that these benefits persisted for 6 months, meaning that, we didn't have just a brief change, but that people were able to continue to use the tips and tricks that we shared with them in sleep and maintained these good sleep health outcomes. So hopefully we have convinced you that enrolling in sleep would be a good idea. Nicole's going to talk a little bit about how you could go about doing that and the details surrounding that.
So we do have sleep groups open. Our next one does begin next week. And then we also have another one starting October 6th. So I did put some links in the chat, and anyone who's listening on the phone, please feel free to call the center and we can make sure we get this information to you. What's on the screen is a QR code, and this is linked to all of our sleep content. So every sleep program that gets listed will be here, and you are also more than welcome to reach out. Sean knows how to find me, so we're happy to get you into a class. But we do have 2 options right now that are enrolling, so you can join, and we do anticipate having additional programs starting ongoing. This is one of my favorite programs to facilitate, so I am adding sessions as we go. All right. Sean, do you wanna pick up here?
Absolutely. We do have some questions that have come through. I'm going to go a little bit out of order because there are some attendees who are interested in learning a little bit more about chronic conditions, but I think we have a few more real direct questions. Let's tackle those first. So the first question is about how many days in a row having sleep disturbances would it be a good point then to speak with your doctor about the issue?
So usually for something like a chronic sleep condition like insomnia to be diagnosed, it's usually trouble sleeping for at least 3 days out of the week for a 3-month period. If you meet that criteria, you will probably receive a diagnosis of insomnia. Treatment for that can include medication. And medication may be a great short-term, answer to your problems to kind of get you back into good sleep. But there are side effects of medication. So people can develop a tolerance to sleep medications, meaning that they'll stop working after a while. People complain of a hangover-like effect. So if you think you're going to be able to get to sleep and then you decide you're not going to be able to get to sleep, if you don't give yourself 8 hours to sleep after taking the medication, when you do have to wake up, you're going to wake up feeling like you're just a mess. You're just, because that medication is still working, but you have to be up and awake. So those are some of the drawbacks of medication. What we know from scientific research is that programs like sleep can be just as effective as medication, if not more so, because their benefits last longer. So if you are taking medication, but you are not addressing the underlying problems that are causing you to not be able to sleep, you're really just kind of slapping a Band-Aid on the problem and not really getting to the root of the problem, if that makes sense. So hopefully that answers that question and can be helpful.
All right, here's another question from Ms. Sadler that came in the Q&A box. Could you talk about sleep heart rate dip? Apparently her watch keeps track of that, and I guess it says that her dip is not optimal. She's looking to see if there's any way she might be able to improve that.
So I'd be interested to know which device she's using. I have to say, for things like Fitbits, for example, they can track sleep for you. And the way they do that is through both heart rate as well as they use light. So if you see the lights on the back of your device that usually kind of rest right over your blood vessels here, they're actually trying to see how much blood is going through at any one time. And based on those two data points, they project whether or not you're sleeping. And then they try to figure out which stage of sleep you're in. So remember the stages we talked about: light sleep, deep sleep, what have you. In terms of sleep research, devices like Fitbits are found to be very good at saying when you went to sleep or how long you slept, but the staging is not very reliable. So I wouldn't get too hung up on whether or not the Fitbit says, oh, you made your goal in terms of different sleep stages. What I would rely on is, how do you feel? If you feel like you're not sleeping well, and this has been a chronic problem, it would be a good idea to talk to your primary care physician about that to see if it's worth getting a referral to a sleep medicine specialist. One of the things that can cause poor quality sleep, even if, let's say you're somebody who sleeps 7 to 9 hours every night, but you wake up during the day, during the night quite a bit, or you're very sleepy during the day, that can be an indication of something called obstructive sleep apnea, or maybe you've heard of it called sleep apnea. And that's where your airway basically collapses during the night. And it can do this very, many times. And each time it does that, you are awakened by kind of doing this gasp for air sort of thing. And you might not remember it, but it's happening. And so, if you're excessively tired during the day, that would be something I would talk to my physician about so that you can get tested. A program like Sleep would not fix sleep apnea. You would need to go and get fitted. Usually it's a device called a CPAP that helps to maintain your airway during sleep. So education and sleep hygiene wouldn't help with that. But if there are underlying problems in addition to sleep apnea, then we could help you out there. So, there are certain disorders that need to be treated by a physician, but for other things that are maybe a little less problematic, give sleep a try and see if we can't help you out.
All right, Dr. Tucker, Sharon had mentioned that she uses the Apple Watch. That's the device
Yeah,
she
so
uses.
same idea. I think it would be something. So typically when we sleep, our heart rate does go down, our blood pressure goes down, and this gives our body a chance to kind of recuperate from the day. We're going to repair any muscle damage that has occurred. We're going to have our brain like flushing out all of the toxic byproducts of brain function. That's all going to happen while we sleep. I haven't seen any recommendations to see the doctor based on Apple Watch saying that your heart rate is not going down enough. But if you do have a heart condition or you're going in to see your physician for a checkup, mention that and see what they say. I'm not a physician, so I can't comment, but just know that there is some error associated with devices like Apple Watch and Fitbit.
All right, another question. Do you have any advice for people who are going through some major life transitions? Maybe it's retirement or, taking a different work shift for being able to adjust their sleep schedule for something more long-term.
Yeah, I think Nicole can probably speak to that, but my first thought would be consistent bed and wake time, whenever that's functional for you. And she can share. We have a lot of people who are retired that have participated in sleep. And one of their struggles or challenges is that, hey, I don't have to be at work at 8:00 anymore. And so if I want to stay up late, I can get up late and it's not going to be a big deal. So I don't know, Nicole, if you want to speak to that, feel free to jump in.
Yeah, that's a really common question in the programs. And like Dr. Tucker mentioned, when people don't necessarily have that consistent schedule built in, it can be a challenge. So for adjusting that, in the program, we talk about having a few days of that consistent schedule to start off. So if there is a big change, maybe switching shifts or something else, going with that consistent schedule, finding what's going to work for that, and then building your routine and remembering the meal times, all those other pieces. Because if you're taking a different shift at work, or if you're recently retired and your meal times changed, your activity times changed, it can be a challenge. So going back to that consistent piece as much as possible. Now, rotating shifts could be more of a problem, but trying to find that one schedule that you can maintain is incredibly helpful.
Yeah, shift work is just tough any way you look at it. And I think, in trying to adjust to shift work, hopefully you're not doing random shifts where it's like, oh, I do the morning shift this day and then the late shift this day or the overnight shift. That's going to be really, really challenging. But if you need to adjust, maybe you're moving from morning to second shift or something like that. Light is a really important assistant, I guess, to help get that circadian rhythm of alertness trained to when you should be falling asleep and when you should be awake. So thinking about when you're exposing yourself to light. The other thing is food is a really important, trainer or assistant for circadian rhythm. So thinking about when you're eating your meals. Maybe, you shouldn't be eating breakfast, let's say at 8 a.m. anymore. Maybe that needs to shift. And so you're shifting your meal times as well. But, that can be so disruptive if you're trying to eat with the family and, they're on a different schedule. We know from research that shift work plays a toll on your body. So, you try to minimize that the best you can, is having consistent schedule and going from there. But I wish I had a great answer for that, but I just don't.
All right. One more question. We did start to look at some of the chronic health problems. Could you touch upon the connection between sleep and PTSD a little bit more? It was on one of the slides earlier.
Yeah, sure. So I'm not a psychologist or psychiatrist, so this is an area that's a little bit outside of my area of expertise. But what I can say is that there have been some studies that have, surveyed people who develop PTSD. And what they find is that if they were having trouble sleeping around, just before the event that caused the PTSD, or if they have trouble sleeping after the event that could cause PTSD, the likelihood of developing PTSD is much higher than somebody who is sleeping well before and after the event. So there seems to be something about REM sleep where your brain is sort of working through these emotional issues. One of the reasons, we don't really know why we dream, but one of the proposed ideas of explaining why we dream is that your brain is working on scenarios, possible plans and ideas of how to handle difficult situations. If you think about it, many of the dreams that you remember are probably kind of bad dreams, right? I can't remember the last one I had, but it was really, I think I was being chased by, I was like in fear for my life. That will wake you up and probably cause you to remember what's going on. But the idea is that the body and the mind are kind of planning out, like, what would you do in these bad situations? And if you're not able to engage in that practice behavior, it may become that these, concerns are more manifested in our conscious life rather than our unconscious or subconscious life. I don't know if that makes a whole lot of sense, but it just seems that making sure that you're sleeping well before and after any kind of traumatic event will decrease, not eliminate, but decrease the likelihood of developing PTSD. And we know that people with PTSD have sleep problems. So if you do have PTSD and you're having sleep problems, working with a sleep medicine specialist will be key, but then also doing all the things right in terms of sleep hygiene to make sure that you're doing everything you can to ensure that you'll get good quality sleep. So kind of a long-winded answer. Hopefully that's helpful.
I think it was. Nicole, the $1 million question, the Sleep Education for Everyone program. How much does it cost?
It's free. We are so thankful to have funding available for this, so everyone can take this program. We do have select locations in person, and we have virtual statewide programs available. So both of the links that I put in the chat earlier are virtual. So wherever you happen to be, you're welcome to log in. You can register ahead of time, and we'll send you all the information. If you have any technology challenges, or if you're not used to logging into Zoom meetings, we'll help you work through that. We do have the phone number available, just like today's presentation.
All right, we got one more question that came in the box. Could you also talk a little bit more about the connection between sleep and heart problems? Are nightmares something that could potentially be controlled?
Let's do sleep and heart problems first, Sean. So we know that both insufficient, like not getting enough sleep, and poor quality sleep increase your risk of developing cardiovascular disease. This again happens through sort of multiple pathways, like we talked about with weight gain. Like lots of different things can change with sleep problems. So in terms of cardiovascular disease, for example, kind of goes back to the heart rate question that we had earlier. Your body at night is going through a period where blood pressure is lower than normal. It is not releasing as much of a stress hormone called cortisol. You might have heard of that. And your nervous system is just kind of taking a break. If you aren't getting enough sleep, the time period for that relaxation phase is shorter. So you don't get the benefits of that, relaxation period. So that's one of the reasons. And so that can promote hypertension or high blood pressure, which can contribute to cardiovascular disease. We also see that there are changes that can occur that really sort of accelerate atherosclerosis or hardening of the arteries. So your blood vessels start to sort of misbehave. They're no longer stretchy and pliant. They start to harden up. Your blood becomes more likely to coagulate, meaning like to form clumps. That can produce a stroke if it's done in the wrong way at the wrong place. So there are a variety of different things that are happening that would promote heart disease. I will say most of the studies that have associated sleep with heart disease are observational, just like it appears that this is a problem, just because heart disease takes so long to develop. But we do see when scientists curtail sleep or shorten sleep or cause disruptions in sleep, that the body does respond in this way. And so the thought is that over time, this would certainly increase one's risk of developing heart disease. As for Sean, what was the second question? Can nightmares be controlled?
Yes.
Yeah, so there's, I'm not an expert in this area either, but if you've heard of lucid dreaming, that's where you can train yourself to be aware that you are dreaming, and then you can control what happens in the dream. And so people use this as a way to boost creativity, to work through problems that they're having, because in dreams, the rules of the real world do not apply. And so you can get, ideas and inspiration that you might not normally get when you're sitting, in your chair thinking about things. So in terms of maybe, I don't know if that would be able to help you to control a nightmare, but people can train themselves to be lucid dreamers, meaning that they are aware that they're dreaming, and they can then change the story of the dream, be the narrator rather than just a passive participant.
All right, very good. I think that'll do it for all the questions that we have here. And as a proud alum of the sleep program myself, let me tell you, I don't drink too many of these cups before I go to bed anymore, because
Good for you. Good for you.
as nice as it is to get that feeling of falling back asleep, it's much better not to wake up.
Right.
Get that full night. So, all right. Thank you so much for your presentation. Vanessa, do you want to go ahead and bring us to a landing here?
Absolutely. So thank you again to Dr. Tucker and Nicole for this amazing presentation. I really don't think we talk enough about sleep health and how important it is. So I really appreciate you taking the time to share this information with us today. So just a reminder, today's presentation has been recorded. We will be uploading today's recording to our website. For those of us joining by computer, when we finish our Zoom meeting, you will see a pop-up window with a program evaluation survey. We would really appreciate it if you could fill that out and provide us with feedback on today's presentation, and also send us suggestions on topics for future lunch and learns and future events. If there's anyone with us that's not currently a member of the HBE program, we would really like you to join. You can sign up over the telephone, and you can give us a call at 313-664-2616. You can also give us a call there if you want a copy of the information shared today. I really encourage everyone to look into the sleep program that Nicole shared with us. We're happy to print off any information and mail to you at home if you'd like any hard copies of that as well. So you can just give us a call at the office for that. So we would like to thank you all for joining us. Please stay safe, and we will see you next month at our Lunch and Learn that will be all about climate change and the environmental impact to older adults. That will be presented by one of our HBE faculty leaders, Dr. Tam Perry from the School of Social Work at Wayne State University, on Tuesday, October 12th at 11 a.m. using the same Zoom information as today. So thank you again. Enjoy your weekend.